As I mentioned earlier, accidental bowel leakage, ABL, or fecal incontinence, which is the involuntary passage of stools, is not uncommon. So what are the causes? Why does it happen? Well, unfortunately, one of the commonest cause is childbirth, especially if it has been a traumatic childbirth. It could affect the sphincteric nature of the sphincter around the rectum, and that can cause it. So for example, if I were to show you the pelvis, so this is the female pelvis, and you can see this is the urethra, the vagina, and the rectum. The rectum is surrounded by this muscle or the sphincter, and then this is a sling called the puborectalis sling. And this sphincter, along with this sling, helps in maintaining the integrity of this rectal sphincter and therefore prevents the stools from coming out. Now, typically, as the bowel is moving downwards, is pushing stool towards the rectum. Now, the only thing that's preventing it from coming out is the sphincter muscle. It is solid, it is strong, especially the inside muscle of the anal sphincter. But if it gets overwhelmed or if it becomes weak, especially with conditions such as childbirth, then it can result in stool leakage. Some other conditions could be if patient has had rectal surgery such as hemorrhoidectomy, or if anoreceptive intercourse, and in some cases it may be associated with vaginal prolapse, but not infrequently it is also associated with constipation. So 60% of women with fecal incontinence also have associated constipation as a problem. So constipation can dilate the rectum, put pressure on that anal sphincter, weaken the sphincter, resulting in stool leakage. In certain bowel conditions such as irritable bowel syndrome or Crohn's disease, also there could be fecal incontinence. So it is very important to understand why is this happening and what can be done to help with the symptoms of this bowel leakage. But at our practice, we completely diagnose and manage this condition right there in the office.